The following is a presentation of the Healthcare Facilities Network. Hello, and welcome to the Healthcare Facilities Network. I am your host, Peter Martin, Vice President of Business Development at Cref. Cref is sponsoring the Healthcare Facilities Network, and I am happy today to introduce my guest, Alison Brisson. Alison is running for ASHE President. She's a candidate for ASHE President. Alison, welcome.
Thank you, Peter. I appreciate you having me on.
My pleasure. My pleasure. So, Alison, it's always interesting, since these don't go sequentially, you never know when people are watching these, but we're going to release them individually. Alison is the second discussion that I've done as a candidate for ASHE President, and I thank her for joining me. Alison is presently the Vice President of Facilities and Support Services at Cambridge Health Alliance in Cambridge, Massachusetts. So she's really right across the river from me. If I could throw a baseball to her, well, I couldn't reach, but you're literally that close to us. So I thank Alison for joining. I saw Alison just last week. Those of you who returned from the ASHE Innovation Conference, we were both there. Hopefully you saw Alison's candidate speech on the first day. Alison, the goal of this is to talk a little bit about the ASHE presidency and your candidacy and your ideas and some challenges and opportunities. But before we get there, as I'm asking, the same to your fellow candidates, we got a new name for the ASHE annual conference. Now it's the ASHE Innovation Conference. What did you think about the conference held last week in Anaheim? And what are your thoughts on that?
Sure. Yeah, the first Healthcare Facilities Innovation Conference, so a rebrand of what we always called the ASHE Annual. I think it was certainly a great conference, great to see lots of folks, excellent education, excellent exhibitors. I did feel like some of the schedule was a bit compressed, and it was a little bit difficult to get to everything I wanted to get to. So, it's difficult because we want to make sure that we give enough continuing education credits out there and enough face time. Really, I would just want to make sure that the conference still provides great value to all of our members, professional active members, and supporting members alike. So I also think, we changed we typically would have a welcome reception on Sunday, and we moved that to Monday, and it was outside and was with food trucks. And I think that was really nice. It was a relaxing ambiance, and people got to really connect in a way that was just kind of laid back and a good way to connect with colleagues. So I felt like that was a win. And the conference was well attended despite all of the travel issues with the crowd strike.
Yeah.
So I was caught up in that in trying to get from Boston over to Anaheim, but
did you get
yeah, but I made it, and it was really a great time. So
where did
seeing everybody there.
Where did you get stuck, or where did you encounter an issue getting out of Boston? Or
yes, yeah. It turned into about a 24-hour day for me of travel,
wow.
just because of canceled flights, etc. But again, I made it, so that was good.
Yeah, no, because a lot of your colleagues, a lot of your former NIHES colleagues did not make it out to Anaheim. What day did you get stuck, Friday or Saturday?
Friday, yeah. I was at Logan Airport at 3:30 in the morning for an early flight and didn't end up getting out until about 8:30 at night. So got to my hotel in Anaheim about 2 in the morning on Saturday.
So what'd you do all day at Logan?
I actually left and came back.
Yeah, good idea.
Thankfully.
Wow, that's a long day. The food trucks that you just talked about, I thought that was a great idea too. I didn't know how that would go over, and I think you used the term relaxed, and it was very relaxed. And was that well received by folks?
The folks that I talked to certainly seem to enjoy it. So I think so.
Yeah. And do you think, and you may not know, but will that be a staple going forward, do you think, on that Monday night or something outside? I mean, that venue was perfect for it.
It was. Yeah, and to that point, it depends on the venue, and the scheduling. So we'll have to see. I'm not sure that we've set the schedule in stone moving forward, but I think that, certainly participating in the survey feedback is important. So if folks have not done that yet, please do that.
Yeah.
It is a way to ensure that you get your continuing education credits, and also a way to ensure that ASHE gets the feedback from all the attendees so that we can make change where we need to.
Yeah. Do you know, you may not know the answer to this. I don't know the answer. What is the percentage of feedback? Like, do most people, is it less than 50? Is it more than 50? Do you get a lot of feedback?
It depends, but it can be certainly a lot lighter than the number of attendees.
Yeah.
Frankly, the same with voting, right? So, ASHE has roughly 13,000 members, and typically for our elections, we only get around 2,300 votes. So, that's important too, to get the word out. If you know ASHE members, if you are an ASHE member, make sure that you vote. It's important.
Yeah. Yes, and I should say, for those watching the video, the voting opened on the 21st of July or the 24th of July,
21st, I think it was. Yep,
and it ends August 21st.
correct. Yep,
Okay. So people, and they can do it. I mean, I'm sure people who voted before know to do so, but you can vote online and
correct. You would get a unique link in your email, so it's important to check your junk or spam filters, because mine was actually in my spam. So make sure that you
kind of
look.
ironic, huh?
Yeah, if you haven't seen it, it did come out on the 21st, so you should have it in your inbox if you're if you're a member of ASHE. You would have had to have been a member before July 12th. So, but yeah, please look for that and do vote.
Yeah, I'm gonna have to do that because I don't remember, and maybe I just didn't pay attention. I don't remember seeing that.
Yeah.
It's ironic that a candidate for president had the ballot go into the junk email. You got to talk to your IT people at CHA.
Right, exactly. Yeah.
So, Allison, before we talk about or before I ask specific questions about running for president and kind of your goals and objectives, tell the audience what's a little bit about your background. You're currently a VP at Cambridge Health Alliance, but what's your background?
Sure. And Peter, this is something I love to talk about, but
Unique.
yeah, I have a unique path, I would say, but I think it's important to look at paths like mine as we look at succession planning, in the future of our industry. So I actually spent 17 years in hospitality management, and I moved into into healthcare actually originally. I had a friend who was trying to recruit me into healthcare for a number of years. And finally, I decided, well, I really would like to do something different. I don't feel challenged in my role any longer, really. And I really wanted to help people. I knew I could not be clinical in any way, shape, or form. I look away when I get my flu shot, but so I actually took a significant leap of faith, I would say. And my first job in healthcare was actually a per diem front desk rep at a family practice. And I was really only in that role for maybe a couple of months until I was able to move into a position that was a practice manager for a new urology practice that the hospital was establishing.
Can I ask you a
So, and
question? Can I ask you, when you were the per diem help desk, did you
yeah,
ever question your decision to leave? I mean, because you had a long career and you had a management level role. Did you ever question your decision to
sure.
switch?
Yeah, sure. And you may know, but per diem doesn't have benefits, so
Yeah.
it was significant. Like I said, I had to have faith in my decision to move. I knew during the interview process that this other management position was coming up, and that I was a very strong candidate for that. And it did work out. So
It did.
um, got to run a urology practice. The great thing was I got experience in the family practice, and then also in a specialty urology practice, which is a surgical practice. So that was excellent. Um, And then from there, the urology practice was purchased. I actually ran it for 3 years, and it was a thriving practice, and it was then purchased by a private group. So I had to decide whether I wanted to continue to work for the hospital or work for the private group, and I really wanted to continue to work for the hospital. So that is when I changed to a position in facilities management, which was actually on the physician corporation side, because they really wanted to have a matrix partner on their side, working with the facilities team at the hospital to ensure that, you know, all of the practices and offsites, et cetera, got the love and attention that they needed. Also, there were a couple of significant medical office building projects that were in the planning stages. So it was a great time to take on that role and help plan, design, and eventually put into operation a couple of big medical office buildings, and urgent care, et cetera. So and then my position transferred over to the facilities team, and that's when really my career really hit the ground running, because I got to work directly for a great mentor that was very involved in NFPA, very involved as a Joint Commission surveyor, was our 2015 ASHE president-elect, and was the Crystal Eagle Award winner last year. So I was able to work for that gentleman for 9 years and learned a lot. And
if people don't know who that gentleman is, I'm sure if they're watching, they probably do.
they might.
What was his name?
Cref provides strategic real estate solutions that enable organizations to get the most out of their physical infrastructure. At Cref, the difference is we're not just advisors, we're operators. Our expertise in strategic asset advisory, project management, regulatory preparedness, and finding operational efficiencies allows us to provide organizations with end-to-end visibility and insight into their real estate portfolios and physical assets. Please visit us at www.cref.com.
It's Dave Deschanel. So yeah, so I worked for Dave, and you know, he really encouraged me to get involved in the ASHE chapters at a local, regional, and then national level, and transitioning from hospitality to healthcare.
Yeah.
While there were a lot of things that were very similar, we had overnight stays in hospitality. Certainly, it's a business that we need, you know, that we ran. We had capital, we had operating, you know, we had maintenance, et cetera. But there's more regulation in healthcare. So learning that and learning how to navigate that, you know, so yeah, Dave was definitely a great mentor to help me learn all of those things.
Yes, yeah, I can't imagine there would be many mentors better than Dave. Now, one of the things you didn't mention, and I know this because we've talked before, tell us about, because I remember we talked about technical stuff. Tell us about kind of your family background and what did you work in for a time?
Yeah, sure. So my family actually owned lumber yards. So I grew up in the lumber industry. I joke and say that my skateboard was actually a pallet jack in the basement of a lumber yard. So, you know, kind of grew up in that industry, and learned a lot from my parents as well. So, you know, they were entrepreneurs. I did ultimately get my degree in business. So certainly, you know, operations, the trades, I have family that are builders. It's all kind of in my blood, I guess.
Yeah,
So,
no. And, you know, you talked about kind of unique career paths and, you know, coming out of hospitality and into the facilities. You know, back when I was doing, you know, the recruiting and the education, I would always talk to organizations. If you're near, like, especially out in the Pacific Northwest, a lumber yard or any of those trades, if you're looking for people, those skills, yeah, not direct, but those skills transfer in and the work ethic transfers in, and you kind of need to think differently, right? As we're trying to solve for this problem.
yeah, absolutely. You know, think about what you really need in the role that you're trying to recruit for. And is it leadership skills that you really need? Do you need somebody to really manage a team and make sure that they perform well? Or is it the the critical skills and the trades that you're looking for? So it just depends. But as I stated too, I was on the physician practice side. So a front desk rep can make this transition. You have to be willing and teachable and have some of those good leadership traits, but you can come from other industries and even other areas within the healthcare setting, and navigate your way through facilities. And it's a really rewarding career. So I'm very glad that I did. I love what I do. So.
Yeah. Yeah, no, it shows. So do you think for for somebody who's not in facilities now, but coming from, say, hospitality, or what do you mentioned willing, teachable, what do you think what are the important characteristics for that person to have so that they can transfer in successfully?
So, like I said, a willingness to learn. So, like I said, there are additional regulatory concerns that we have in healthcare. But if you are willing to embrace that education that's available through local chapters of ASHE, it's there for you to learn, and there are mentors out there to help you learn. So do tap into those resources. And one of the best things about the ASHE community is you can phone a friend. So if you're having a difficult time with something, you can call someone up who will likely have the answer or the best practice to help you navigate. So I can't overstate the importance of the professional membership groups and the support that has given me throughout my career to learn. So, people learn new languages, they learn how to play an instrument. Well, you can learn how to be successful in facilities management as well, if you're willing to apply yourself.
Yeah, that's an interesting comparison. Learn new languages, learn instruments, learn facilities. So tell us, why are you running for ASHE president? What is it about the role? What motivates you to run for the position?
Sure. So I actually am completing my 4th year on the advisory board. So I've been elected twice, so 2-year terms, two 2-year terms, I should say. And so the next step is to run for ASHE president-elect. Otherwise, I'll be completing my time on the board.
Yeah.
I feel like I have a lot more to give. I am somewhat of a pioneer, and I like to think a little bit outside of the box and try to find ways to do things slightly differently, respecting history, but different in a way that we're listening to our membership and bringing things to our membership in a way that is best for them. So I was able to help influence and participate in the strategic plan of ASHE 3 years ago. We're currently working on a revised strategic plan, and that is also helpful just to have some of the history to help inform the new plan moving forward. It's also helpful, having 4 years on the board, kind of knowing how to navigate the ASHE leadership structure, which staff to go to. It does take a little bit of time to kind of figure that out. And also, I would be remiss if I didn't mention my local leadership activities. I kind of came up through the ranks. I was a conference chair for the New Hampshire group when NIHES was holding a meeting, and New Hampshire was the host chapter.
Yeah.
So I started as a conference chair, and then from there I became NIHES treasurer. And then I was, and for people that don't know, NIHES is New England Healthcare Engineers Society.
Thank you.
And
you say it
and
so
then
much. You don't it's always NIHES.
Right.
Well, not
We have
everybody.
lots of acronyms in healthcare, including our professional membership group.
Yep.
But from there, I was treasurer for a couple of years at NIHES, back when we used to write handwritten checks before we really had a strong management group to help us along the way. And then I was president of New England Healthcare Engineers twice before running for the regional position. So, I'm running for president because I feel like I have a great history. I'm dedicated to the profession. I am very collaborative, can think outside of the box, and I have some great ideas to help ASHE be relevant long into the future.
Well, I wanted to ask you about the strategic planning process, and I'll come
Sure.
back to that, how difficult it is. But since you just said you have some great ideas to help ASHE into the future, what are they? Can you give us a couple?
Sure, sure. So I think that one of the ideas that we have, or that I have, is to kind of create right now we do have a leadership institute, which if you've been an emerging regional leader, if you were lucky to receive that award, which I did, and I was able to go through this leadership institute, which is a 4-year program that ASHE puts on, mostly focused around Ken Blanchard leadership training. I would like to do a kind of a leadership 2.0. And what I envision that as being is more executive level leadership skills to help develop our supervisors, managers, even technicians, to prep them for leadership roles like a vice president, like myself. So kind of integrating those management and leadership skills at a more advanced level. I think that also will help us have conversations with the C-suite when we need funding, et cetera. So I think, adding that executive level training would be important. Maybe it doesn't need to be a 4-year program, but I think we need to look at integrating that into our educational offerings. So that's one thing.
One thing about the, you mentioned the C-suite. I don't know what the number is, but I can't even speak. But I'd imagine like more than half the sessions they don't focus on suite, but C-suite is woven into everything. Like that communication with the C-suite, it's so critical. Even if you're going with something about boilers, there could be an element of a C-suite in it, because ultimately that's where you're going with the request. It's just ubiquitous, right? C-suite, C-suite, C-suite. You can't get away from it.
That's right. So we have to really be able to partner. Another thought that I have is really trying to collaborate better with the other professional membership groups of the American Hospital Association. So, and even our colleagues in the Nursing Association, AORN, physicians, rather than competing for dollars, I would rather walk in lockstep for dollars. So, it's not just about getting the most fancy robot for the OR. It's also about making sure that our infrastructure can support and sustain so that fancy robot can be used over the long term. So let's partner with our nursing leaders, our physician leaders, to help advocate for us. Even our colleagues in risk, et cetera, so that we're all helping to elevate, the work that facilities does and the capital dollars that we need to keep our institutions running.
How do you go about creating that partnership?
So I think that there are opportunities by leveraging our work with the AHA, so the American Hospital Association, and the professional membership groups that are part of the AHA, and trying to integrate some of our education programs into their conferences, and vice versa. And or just having regular touch base conversations so that we can make sure that we're all aware of what each other is doing and the value that we all add. So I think, having those conversations, it's, even the nursing associations or the physician associations, why does the door have to be closed and only open to those folks? I don't think that it does. So I think that if we knock on the door and ask to come in and ask to talk a little bit about what we do and how we need their help, that would be a great start. So I am starting to do a little bit of that at the local hospital association level, and would like to continue that work nationally.
Are they receptive to it as you start locally?
Yeah, absolutely. Yeah.
Yeah, I mean, it's a different approach, right?
Mhm.
Yeah. What other ideas do you have?
So I think that another important, I talked a little bit about the Leadership 2.0. I think that also we need to really bring our education and resources to our members in a way that is accessible and affordable.
Mm.
So I think we need to look at some different platforms to be able to deliver education. Not everyone can get out to a 3 or 4 day conference. So I think as we look at the world of having information at our fingertips through AI, et cetera, um, we need to look at a platform to be able to deliver education in that way. So I do have a great idea in the works for that I can't talk a whole lot about, but it's going to be, I think, the wave of the future to make sure that we have the answers that we need at our fingertips.
Huh. When can you reveal this?
I would say it may be at least a couple of months.
It's got to be a big I mean, but imagine it's a large undertaking to figure.
Yes.
And you talked about kind of bringing education. I always worry, I don't know if worry is the right word, but like you look at some of those critical access hospitals where they can't get away. I mean, they're a one-person shop in the middle of nowhere, and they're said is part of what you would look to do to bring education to them and have it available for those who can't make it to Anaheim or Minneapolis or wherever it happens to be.
Yes, and we do have some of those programs currently through ASHE, but I think we need to make them a little bit more affordable and more attainable. But no, my thought is more really around utilizing and leveraging technology to be able to get education and knowledge out to the folks that need it the most.
We'll be waiting.
Yeah.
That's a good one. So within those, within that, and is there anything else left on your platform? I don't want to.
Yeah, the final thing I would say is that we need to continue to fortify relationships with folks that are dedicated to bringing new people into our industry. So the community colleges, even working at the high school level, I actually joked and said, maybe around our labor and delivery units, we need to give them a welcome packet to facilities engineering and a little baby hard hat. But no, that's not a real approach. But I think that the earlier the better that we can talk with folks. And as I, talked about a little bit earlier in this interview, is really thinking about what are some of the transversable skills,
Yeah.
transferable skills that people have that would work well in our industry. So looking at other industries to try to recruit and bring folks in.
Yeah. Well, I mean, you mentioned that, to babies who are who are being born, but I was talking to I occasionally speak with Mary Ann Richards from Mass Maritime Academy, and I know a lot of the NEHES folks either attended Maritime, and it's a great resource out here in New England. But in talking to her, she was saying that organizations come to Mass Maritime and say, why don't you have more people for us? Because they can't produce enough people. And she was saying they are starting to even go down to reach out to 7th and 8th graders I mean, you're right. You gotta, and she's like, we got to get them early. Because when I was in 7th grade, I don't know, well, you were in the lumberyard, but the last thing on my mind was what I'm going to be doing. Didn't even give it a thought.
No.
No.
I mean, even in high school, I thought I was going to be a physical or occupational therapist. That's what I thought my path was going to be, and it totally changed.
Yeah.
And then changed again. So, just looking at those opportunities and recognizing that sometimes it's not always just a straight path. It can have some twists and turns.
Absolutely. Yeah. As I said, I mean, that straight path, that's the aberration or whatever that word, that's the outlier these days. Very few
Exactly.
people just follow a straight path. So you got your platform. As you look at challenges and opportunities in healthcare facilities management, both from, you know, your perspective of a vice president for Cambridge Health Alliance, and, you know, you're on the board, but even as president, what do you look at some of the challenges and opportunities holistically, not just from a prism of ASHE, but others?
Sure. So, you know, I think that there are a number of challenges for healthcare. You know, we're certainly challenged for dollars. You know, challenged to reach all of the patients that we need to reach in the community that need our help, and challenged for staffing. You know, I have several openings, I think, on my public safety team right now, food services, EVS, and you know, we're looking at different ways to partner with local organizations to help maybe bring English as a second language education to folks that would be great candidates to work in our organization. So, you know, I think we need to share what we're doing across the country to be innovative and try to help ensure that we can fill those critical positions, and also sharing. And we are doing a pretty good job of this, I think, but sharing the ways that we are able to reduce costs, but maintain a high level of operations. So it's always a challenge, but we have some folks that are doing really, really well with that, and we need to share those best practices. So the ASHE community is one of the best places to do that.
Yep. So what do on a local level, what do you, or what do some of your team members do to kind of share that news?
Yeah, absolutely. So the New England Healthcare Engineers Society meets regularly as a board, and we certainly share, you know, hot topics, information that we've learned through survey processes, when there's opportunities to influence code, and we really want somebody to, or folks to put in comments regarding codes, and connections. So, you know, you may need somebody in a particular portion of your industry, and you could reach out to a colleague and find out who the best connection is for that. So, and then, you know, with ASHE, my ASHE community is also a great way to ask questions and get answers and get connections. And I'll say too, LinkedIn, you know, is a great way to connect with folks, ask questions, and learn from others. So hopefully that answered your question, Peter.
It does. No, it doesn't. And I think you're right. I mean, it's like sometimes the last thing you want to do, or the last thing you have time to do, is to share some of that, right? Because you have so many competing priorities. It can easily fall to the, you know, as you're looking at things, that can fall quickly on your list of priorities.
Yeah, absolutely. And these are volunteer organizations. So yes, it's making the time to do it. I can tell you that I feel that it's time very well spent, and it's time that I would never want to give up. So, you know, but you do have to balance your, you know, your professional role and participation in the professional organizations, which help support your professional role. So, you know, it is important to just try to make time to do that, and to help your leaders understand the value of that. So,
how do you find the balance to do that?
I work a lot. No.
So once you say you work a lot, you're throwing that balance off.
Right.
But I mean, you can't not.
Right. Yeah. Yeah. You know, for me, I don't have children at home, so I have a little bit more flexibility in that regard. But I think you just have to make the time and find what's important to you. And it's also important to build your team up. So, you know, I can go to an ASHE conference knowing that
Yeah.
I've got a good team that it has been trained and knows when to escalate things to me. But I've got a good team here that is helping to keep things going and helping to support me so I can do that. But I also want to bring things back to my team. And so it's, it's definitely a two-way street there. And in some cases, my team is going and I'm staying behind. So it's,
Yeah.
kind of sharing those resources and determining who needs the education and the resource and when, and then supporting each other to make sure that it gets done.
Yeah, no, I mean, more so today than ever, that, and you're just still describing, communication just runs through everything, right? You can't survive without it. And what's kind of surprising to me is, and at least back in my recruiting days, you still would hear about leaders who just couldn't or wouldn't communicate. And it's like in 2024, that's still a little surprising, because I don't know, what the breakdown is between technical and soft skills that you need, but you could have the greatest technical skills in the world. If you can't communicate, you can't succeed.
Yeah, absolutely. One of the things that because my facility directors are spread out across the region, so my direct reports are spread out. So we have every morning a huddle that's virtual. We just use a simple Google Sheet, which has a nice chart there of things that happen in the last 24 hours, what's coming up in the next 24 hours, any major safety concerns, anything globally that we need to know about. Does anybody need to connect with each other? It's 15 minutes in the morning. And they have, it's a tiered huddle process. They have a meeting with their teams prior. Then we have ours, and then I report up at the system level huddle. So it's that tiered huddle communication up and down the chain every day that is so
Yeah.
important to be sure that we're all, again, walking in lockstep. So.
Right, because you can get out of lockstep quickly.
Yep.
Is there anything, so I'm talking to Alison Brisson. Alison is the Vice President of Facilities and Support Services with Cambridge Health Alliance. She is also a candidate for the ASHE Presidency. This is the second discussion we've had. I've talked to Danielle, we'll talk to Dennis. Today we're talking to Alison. Thank you. Alison, in closing, is there anything we didn't cover relative to your candidacy, relative to your ideas for ASHE? Anything we didn't cover, anything I didn't ask you about, or any final thoughts for the folks who are considering voting?
I would just say, please do vote, regardless of who you support. And a vote for me would certainly be appreciated. And I would promise you that I will be your voice, will help advance ASHE. I do have the most experience on the board, so you can trust that that I have the experience to be able to get the things done that we need to get done to help ensure ASHE moves forward into the future in a great way. And if you have any questions, feel free to reach out to me on LinkedIn, or through ASHE, or through my email at CHA.
I'm glad you brought that up, because that just triggered, and I apologize, because you do want people to remember what you just said. But I also want to ask you last question about strategic. You were talking about doing strategic planning with ASHE. How difficult, like, you alluded to it, right? You're working on something with technology that you're going to hopefully roll out in a couple of months. How difficult, and with sustainability and with workforce shortages, with all of the issues, how difficult is strategic planning in 2024 going out 3 years, 5 years? What are some of the difficulties you face as you do that?
So I think really it's looking at kind of all of the sort of disruptors to the healthcare environment, and making sure that you're using that information to set your strategic plan as informed as possible for the next 3 to 5 years.
Yeah.
Um, The great thing about the ASHE board is that we have 10 regions, so good representation. We have a pretty diverse board right now, which is amazing. It wasn't like that when I entered into this. And so I think we're hearing a lot of different perspectives and ideas to be able to help move us along. Not everybody agrees all of the time, so sometimes we have to get consensus
Yeah.
and then figure out, you can't necessarily do everything. So you have to figure out what are the most important things that you really want to try to accomplish over the next year, 2 years, 3 years, 4 years, 5 years. And then we have a great structure of committees and task forces to help us move that work forward. So it's been a good process, a lengthy process, but a good one, and I think pretty well informed.
Well, I like, I think the critical word you use there, look at the disruptors, right?
Exactly.
Because the disruptors aren't going away.
Right.
What are the disruptors you look at? What are, and you don't have to go into deep, but what are some of those disruptors?
Well, I think certainly, lack of funding in healthcare, the inability to get folks to conferences. Some organizations are cutting education, which is really unfortunate.
Yeah.
So trying to make change there where we can. As I talked about, trying to make resource education and networking resources available either more locally or through technology, I think is really something that's going to be important in the future. So those are disruptors, the aging workforce, not having enough candidates. We've talked about that, how to move those things forward as well. The changing healthcare landscape. We see hospital closures, we see consolidations. What does that mean?
Yeah.
We have advancing technology too for infrastructure. How do we implement that? Climate change, and how do we make changes to our infrastructure to support that work? How do we find funding for that work, and how do we do it in a timeline that's reasonable? So those are all things, and those aren't the only things, but those are all
Right.
things that we consider.
No lack of disruptors in that room. So Alison Brisson, thank you for your time today. I appreciate it.
My pleasure.
So this is Peter Martin for the Healthcare Facilities Network and Cref. As always, thank you for watching.